distinguished speaker today to speak on the next, Dr. Jaswant Patil. Jaswant Patil has done his post-graduation from KM Hospital, Mumbai. Thereafter, he has acquired some clinical skills from Cooper Hospital and Jaslok Hospital and established with a well-equipped hospital to manage the surgery. But as we know that history of Kent was converted to homeopathy because of his wife's illness. The same thing has happened with Dr. Patil. Patil's mother had some organ failure and the existing system, allopathic system, could not help him, though he has mastered in clinic, in emergency cases. Still then, nothing could be done for his mother. And then he switched over to homeopathy, and homeopathy has given her life to his mother, and therefore he has converted to homeopathy and become a committed homeopath. With this, he is very philanthropic. He has established his clinics at many places. He is serving the people also. So I would request Dr. Patil to begin with session. His session is, he will be dealing with homeopathy and allopathy because he is the best person to understand both the systems of medicine. With this, I welcome him and request him to go ahead with his lecture. Thank you so much.
Thank you, Doctor, and all the dignitaries. Good morning, namaskar. आज आपण इतके सगळे इथे जमा झालेलो आहोत. We all are together to bring homeopathy a new shape. And आज जे ढोल ताशे वाजलेत, हे ढोल ताशे असेच वाजतील if everyone follows what Adil says. Adil बोलता है, वैसा अगर हुआ तो होम्योपैथी के ढोल ताशे इतनी ही जोर से बजेंगे क्योंकि हमें होम्योपैथी 200 साल से जो चल रही है, whatever is going on for last 200 years, we have to go ahead, and we can take homeopathy ahead only and only if we get a protocols, and there should be no terrorizing, there should be sure shot remedies and sure shot results, and that too out of 10 we should get 8 results minimum. Then only we will shine and we will see that homeopathy shines everywhere in the world. It will be accepted because we are absolutely powerful. We are very, very powerful in homeopathy. What is the power of homeopathy? That I am going to tell you today. And I have seen myself that what homeopathy can do. Dr. Manish Patil told me that, sir, you have to talk on scope and limitations with integration of allopathy with homeopathy. I would say limitations are there for allopathy, not for homeopathy. Because where allopathy stops, homeopathy begins. And that is what is my personal experience. I am an allopath, MD pulmonology, then I did my cardiology. I was putting pacemaker temporary in 3 minutes in the heart without giving a cardiac shock. And then I was a great hater of homeopathy. I used to disbelieve homeopathy. Homeopathy is nothing, it's bullshit. That is what were my words. When my mother fell sick, you all know, that turned me to the homeopathy because the last stage of my mother was brought back to the life for 12 years with single dose of RSI 200. That is the power of homeopathy. Homeopathy has given me a lot in my life. And today, Manish Patil called me that, sir, you're coming for the lecture. I say, I am sorry. I can't come. I was so sick. Last February, in the last month of February, I fell sick. I was not knowing. 3-4 days, cold cough. Finally, I was with rigors and high-grade fever. 104 to 5 was my temperature. And I was in delirium. Stuporous delirium. My daughter, she is doing her MD dermatology. She ran and came home. My son told, Papa is in fever and he is not responding. So she came back. And I had told her about in the COVID time, ki beta, I have set up the protocols, you learn. I said, no, Papa, I want to first complete my allopathy and then I'll listen to you. I said, okay, you listened that time. But now today, tomorrow if something happens to me, who will give me treatment? So you should learn the protocols. And the protocols that I had set into the webinars of the COVID times, I told her 1, 2, 3, 4, this happens, this happens, this happens, this. And she had noted down. She started the treatment with 104 to 105 fever, not a single crocin I have taken. That is because I had told her that homeopathy has a power. Don't give me paracetamol. It is the worst thing to take paracetamol in fever. It is given in allopathic books that fever comes to stimulate your bone marrow to produce more immune cells. It has got bacteriostatic and virostatic activities. And this potential of that fever was known to Dr. Hippocrates. He said, God, give me the power to produce fever, and I can cure every disease. Every disease I can cure. And today we say, God, give me the power to bring down the fever with artificial things. That is wrong, where the patient goes more into the deterioration. Finally, I was out from my fever. It remained to 2.4 for 2 to 3 days. And my CRP increased to 265. Absolutely, a voice couldn't come from my larynx, vocal cord. I was so down, and everybody was afraid. My daughter started crying. Papa, your WBC count is 28,000. Your CRP is 265. Your oxygen has dropped to the 85. What are you doing? I'm taking you to the ICU. I said, please don't take me to ICU because I have worked for 5 years in ICU. I know what will happen there. Finally, I will be on the ventilator and I will not come back. So even if I have to die, let me die by homeopathy because I'm sure I'm not going to die. And there she started giving me medications. Pyrogenium, Baptisia, finally, Stramonium 200 brought my fever down to 199. It was only on one rubric. After I regained my senses, I said, give me Stramonium 200. Only on one rubric, Delirium during septic fever, given in Fatak. Only one rubric, only one medicine is there. But septic fever, delirium, Stramonium brought me back. And today, I'm here with you. And that too, with that, I had 4 patches of pneumonia and rising cholestatic jaundice. Bilirubin was from 1 to 4.8 in 4 days' time. And my x-rays I have taken serially every day. Every day we used to do blood investigation, hemoglobin falling, and at the end of 7th day, all parameters came to normal, and x-ray shows 80% regression. At the end of 15 days, it was 100% regression. That is the power of homeopathy. And what Adil has said, I 100% agree with you. He is telling the truth. We all have got powers of homeopathy, but what we lack is acute management and life support system. And immediately this should be taken into the homeopathic curriculum so that I'm an allopath and therefore I can practice. You cannot practice because you have been not taught. You are equally intelligent. What I have got intelligence, everyone has got that intelligence, but scope was not there. And therefore, this has to be introduced into the homeopathic curriculum and it has to be noted. Next slide. Integrating homeopathy and allopathy, scope with limitations. I have said there are no limitations for homeopathy. But there are wide scope for homeopathy, and where the limitation is there, where you all who have come from BHMS have been not exposed to handle and told not to take up the serious cases because you have been not exposed to the acute management, ICU management, serious managements, and therefore we need to learn from this. Next slide. The time is less, so I have to be very fast. the scope of homeopathy from common cold to cancer, acute diseases, all chronic diseases, all given up hope cases, immunity enhancements, adjuvant to allopathy to prevent side effects, and adjuvant to allopathy in post-operative care. So if in such cases, there are conditions, I don't say that allopathy is all the time bad. It is good, but provided it is practiced very nicely that I have seen. The ventilator management is so tricky and so meticulous. I was an intensive respiratory care unit registrar. That time I have said that even every hour you have to do the ventilator management, then only patient comes out. Otherwise, it doesn't come out, and that needs to be taught to a homeopath. Next slide. Limitations of homeopathy. Next slide. When disease deterioration is fast, selected remedy not working within hours of administration, patients' hemodynamics are stable when there are chances of patients requiring support when general condition is poor, when oxygen saturation low, pulse rate is 140, respiratory rate is 30, and there are irregularities in the pulse. Why here? Because here we need to investigate and research homeopathy even to tackle all these diseases, but at present, we have got these limitations and we have to follow those limitations, and for their integration with allopathy is important. Why I didn't go to allopathy at this time? Because I was knowing once I go there, they will restrict not to give homeopathy. And I know that in such cases, only allopathy with homeopathy can bring out a patient. And because of that fear, I had taken risk. But with God's grace and power of homeopathy, I am here with you today. Thank you. For this, next slide. Steroid-dependent cases, immunocompromised, uncontrolled diabetes, very low vital force, and severe cardiac diseases. These are the problems which can cause sudden problems. Sudden heart stoppage of heart. I'll share one case where in the ICU, there was a case which was brought 15 minutes dead patient. This is a fact. I'm not boasting and I'm not telling you wrong because I got a video testimonial of it. This was brought by my friend. I said, I stopped my ICU now. I'm doing only homeopathy. He said, Babare, you do something. I brought back all the instruments from the top of the cupboard and started giving her shock with the ambu bag and ventilation and showed the relatives, this is a flat line. I can't do anything now. And the patient was declared dead. Finally, I came back in my cabin and said, I've done a wrong, I've done a false thing. And then I looked at God and immediately it struck to my mind, why not give a camphora and give a DC shock? So I went back. I brought a camphora, 200, and gave a DC shock and the heart rhythm started. Where I had given three DC shocks, patient was not revived, and that patient lived for 8 years without a brain damage. That is a wonder because along with that, Cactus G, Cratagus G, 6C were given to take care of the arterial, coronary arteries, and arnica to revive from the damage. And therefore, this is the power of homeopathy. And these indications one should know how to treat, not just by taking the history on the mind and this. It is very important because without that, we do not get success. Even if we select these small remedies, unless until mind is given importance, we are not going to get the best result because that is also important. But along with that, if you do this, the results are marvelous. Next slide. Next slide. If we integrate, then it will be the best system in the world and we can save many lives. Next slide. Benefits are, medicines are affordable, simple to administer. Mechanism of homeopathy is to energize the immunity and basic systems. Allopathy to kill the disease and reduce the disease load. And therefore, the proper combination, synergistic, will give more marvelous result and the mortality can be brought to less than 0.01. Next slide. This is a case of Mane. He is post-COVID GB syndrome followed by delirium, high-grade fever due to severe infection, inflammation, skull osteomyelitis, and he was into delirium, not responding to these treatments. Finally, like a zombie, he was discharged. saying that he is going to die, take him home. That time, his son contacted me from Singapore and said, sir, can you do something? I said, I can try, but don't expect any miracles because he is almost into a multi-organ disease. And that time, he was given pyrogenium, arnica 200, hypericum, natrum sulf, because all these are nerve remedies with one dose of hyoscyamus, which was his, from the what he was talking about everything, and he was too much attached, love detachment is very difficult, is hyoscyamus, and that made a miracle. So next slide. He was with Guillain-Barré syndrome and with absolutely paralyzed, lying in the bedridden. And from there, he was discharged on IV fluids. Next slide. Next slide. Next slide. Next slide. Fine balance. Slowly tapered down all allopathic medicine. The only allopathic drug was for thyroid, diabetes, and blood pressure. This we should not discontinue. Otherwise, patient goes into the problem. Detailed weekly report and elevated symptoms. This slide is prepared by his son. Next slide. Next slide. See now, just let it remain. So what he wrote himself, the miraculous report, before homeopathy and after homeopathy. Complete disorientation. After homeopathy, fully aware and can differentiate day and night. Had to bathe him, brush his teeth and shave. Now bathes and shaves, brushes on his own. He was not going on to the toilet because he was with diapers, heavy nausea. Now, without diapers, he can go to the toilet. No interest in seeing news, reading paper, cannot sign, and cannot engage in meaningful conversations. Now he can sign, is helping on building society matters, and can even type WhatsApp message, attended family weddings, strikes, and meaning of conversation. This is the power of homeopathy. And this is brought by not only single drug, but multiple drugs and given repeatedly as per the whatever comes in front of you. Don't hesitate. Give it. You'll find some other remedy. And the beauty of it that I cannot show the whole videos now. All these things, I was saying this is not correct homeopathy, but finally when he got this best result, all the eczema came on the skin, which he had suppressed some 20 years back. And how this by Hering's law with multiple drugs, giving the drugs as per the indication, even if the indication changes next hour or 20 minutes, you give that remedy and you'll see the result. With fear, if you don't give, you'll not get the results like this. Next slide. Next slide. He has given the testimonial that the homeopathy has done a great to him. Next slide. Acute cases of severe COVID. I think many of you have seen the videos and cases that I have presented. Next slide. But here I would like to show some beautiful, grave cases, not beautiful. We cannot call that grave case a beautiful case. Next slide. He was a case of severe COVID. Hospitals were full. No oxygen was there at that time. He said, doctor, please do something, otherwise I will die. We brought a cylinder at house. Play the video. We bought a cylinder in the house and said, 3 liters, 4 liters with fatafat. I had given those protocols. Arnica, Baptisia, Eupatropine per Bryonia. Bryonia was working most, but just Bryonia could not give the 100% results. So we were to cope up with giving Carbovage repeatedly. And you will see that this patient who was with 40 oxygen means no one will keep at home. Everybody will be, I said, I am taking a risk. He said, sir, anyway, I have to die there, here, at least mera kriya karam hoga. This was his attitude, and therefore I said, I will try this case and show this case as an example what homeopathy can do. And if the homeopathy was integrated that time to the allopathy, so many lives would have been saved. Next slide. Next slide. Next slide. Now see this man who was with just 3 to 4 liters of oxygen. Now he is walking and he is fine. And in a matter of only 12 days, in the matter of only 12 days, he was not given a single allopathic drug. If this power of homeopathy was mixed with, integrated with allopathy, so many deaths would have been avoided, but no one took a heed that time what homeopath was saying. Next slide. Next slide. Next slide. Next slide. These are all the reports, you know, this improved, that improved. So I want to show you something more important. Time is less. Next, last slide, Lena. Last slide. Next slide. This also, next slide. Next slide. Next. 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 This is a mucormycosis case. Finally, 80 injection amphotericin given, no result. Surgery done, no result. Finally, patient was left to die. And she was discharged. She came to hospital, civil hospital. From there, they said, anyway, either if the death occurs, we'll have to do this, that, postmortem. So she was taken home. And finally, next slide. Next slide. Next slide. These are the proofs. Next slide. Next slide. This is what the medicines were given, I have written. It was given in a repeated daily. Daily, not just single dose. Repeated daily, 1 hourly. And this was her state when she was brought. She was into delirium. The infection was going into the brain. And they couldn't operate because it was all mucous mycosis was spreading like fire. And finally, then after the medicines, you can see that this happened in a matter of 7 days. There are so many things that she started doing this. And finally, the improvement, you know, what was the improvement? On one case that I have shown, that now she is doing all the घर का हिसाब. घर का हिसाब करने लगी. This is a power. See how she is enjoying the life. And this is only and only because of homeopathy. Proper integration would have done that time. She would not have been so much of a zombie that she was that time. Next slide. Next slide. This is what doctor, he's an orthopedic surgeon and a owner of a COVID hospital. What he has to say, you can just play this video. The voice is not coming. Anyway, he's saying that he was saved because of homeopathy. And he said that if government will accept my experience, that this particular, in COVID, if the homeopathy is integrated with allopathy, so many lives can be saved. And homeopathy should extend their help to these centers. But that time, so many problems we had faced. Only few who cooperated. We have seen the results of homeopathy. Next slide. Next. Can you play this video? He is a neurosurgeon. Final case of integration. I'll show you. I got n number of cases, but time is the limit. He was with chlorine poisoning on ventilator. On ventilator, the PEEP was 5 and it increased to 7, 8. And finally, oxygen was not coming above 60. And this was a case where I came and gave homeopathy along with acupuncture, which my sister does. And within a span of 12 hours, the oxygen improved. Next day, he was weaned off. And in the evening, he was off ventilator and taking food in the ICU. This is the power of homeopathy. And to the surprise, he was in the same hospital where he operated a neurosurgery case on 5th day. That is what he's telling. It's video is not audible, and that's the final thing. Okay, this is all about the powers of homeopathy, when to integrate, when not to integrate, and how to come with the best homeopathy, which everyone will learn in this scientific research session, and the research should be done. I wish you all the best, and thank you for the patience.